Welcome to Connected Care Education. Today we are going to look at Unit 002, Principles and Values of Health and Social Care Children. Unit 002, Outcome 5, Understanding how positive risk-taking supports well-being, voice, choice and control. Positive risk-taking and the importance of being able to take positive risks on the well-being of individuals. Positive risk-taking and the importance of being able to take positive risks on the well-being of individuals. Introduction. Supporting positive risk-taking is key to the implementation of individual-centred planning and approaches, which are aimed at increasing inclusion and promoting people's participation in their care and service delivery. The value of positive risk-taking to children and young people. Managing the risks is an important role within practice. Being able to discuss potential risks and how best to manage them is an area of discussion with children and young people in order for them to make informed choices. Children and young people must be given the support they need to take the risks they want and to make informed choices. New experiences and greater community involvement potentially involve children and young people taking risks that offer opportunities for the development of independence, confidence, well-being, voice and autonomy. Please pause the video here and complete Worksheet Learning Outcome 5, Worksheet 1, the value of positive risk-taking to children and young people. Rights of children and young people to make choices and take risks. Making choices and taking risks. Providing real choice and control for individuals accessing health and social care means enabling individuals to take the risks they choose. Everyone has the right to take risks and make choices. However, if a child or young person does not consider the potential risk involved, they will be ill prepared. Therefore, being supported to view potential risks and how these can be minimised is an important lesson in being able to understand choices and consequences. When we look at risks, we should do so in relation to individuals' strengths, abilities and support networks. Everyone should have the right to make choices about their lives, so it is important to work out whether a risk is significant and whether it is likely to happen. Health and social care settings must be able to demonstrate that a risk assessing process, a process of thinking things through properly, involving children and young individuals and others who know them, has taken place. This may or may not result in a formal written risk assessment. How balancing rights, risks and responsibilities contributes to child-centred approaches. Rights, risks and responsibilities. The following are occasions when a risk assessment should be completed. When planning activities, outings and events. When planning new facilities. When new work practices are introduced. When a child or young person has a specific need or where there is a significant change to their existing needs. In addition, there should be a system for regularly reviewing the risk assessments. No risk assessment should be written without a review date, monthly, quarterly, 6-monthly or annually, depending upon the need. This practice ensures a child or young person has full control, responsibility and voice over decisions affecting them, utilising good practice in the form of child-centred approaches. A risk assessment is carried out when the child or young person is informed and guided in weighing up the risk with the benefit or drawbacks from undertaking the identified activity. Health and social care workers support children and young people to balance their rights, the risks and the responsibilities. Please pause the video here and complete Worksheet Learning Outcome 5, Worksheet 2, Balancing Rights, Risks and Responsibilities. Considerations needed when supporting children and young people to take positive risks. What to think about when supporting children and young individuals to take positive risks. For many children and young people, taking risks is a part of everyday life. However, children and young people with a disability or mental health illness, for example, are not always encouraged to take risks. This might be because of their perceived limitations or fear that they or others might be harmed. The same applies for vulnerable children and young people. There are concerns that they do not know about or understand the dangers involved and should not be encouraged to take risks. Changes in society's attitude towards disability, social care and health issues means that children and young people are being encouraged to increase their independence in their daily activities and decisions about the services they receive. The focus is now more on enhancing children and young people's abilities rather than concentrating on their disabilities and things they cannot do. Minimising risk. Risk can be minimised by the support of others, but in promoting independence, responsibility for taking risks must be a balance between safeguarding a child or young person from harm and enabling them to lead a more independent life where they effectively manage risks themselves. A balance has to be achieved between the stage of development and life experiences and wishes of children and young individuals to do everyday activities in line with the duty of care of services and the legal duties of statutory services. As well as considering the dangers associated with risk, the potential benefits of risk-taking have to be identified. This should involve everyone affected: children and young individuals accessing services, their families and carers. Please pause the video here and complete worksheet Learning Outcome 5, Worksheet 3, Minimising Risk.